The patient better be balanced. If I push them and they fall off the table, you'll lose all your points.
All of them?
Huh?
Automatic fail.
I'm the patient for that one.
Whoever.
Yeah.
Wait, are you guys in?
So when you do it, make sure you expose the skin. You'll essentially what he's doing right now is he's just flexing the top leg. And
So flex this until you feel that stop moving. You lock her out right there. All right. So then, I know I took my hand off. All right. So
I'm too close.
she should be able to roll. All right. So that's what he was talking about. Where if you push the patient, she shouldn't fall off the table.
oh,
All right. So you can find your segment again. All right. So right here. So let's say I'm on L4 here. All right. So you can use your fingers like this. So you're on the underside of L4, on the underside of the spinous process of L4, and then with your offhand you'd be on the superior side of the spinous process of L5. All right. So when you're here, she should already be locked out because you've already assessed that the joint's no longer moving with her hip flexion. And then here.
I'm too close, man.
Here. And then you can have them either breathe, or once you have them locked out, then you apply your force that way. So you apply your downward force here, your upward force here.
So the top hand is on the
Down.
bottom side of the top segment. Does that make sense?
Right. So you can up that way, down.
And then the
No, because she was saying that like my right hand being on the top would be under this.
No, she
on
said
the
the
underside of L4,
yeah.
and then this hand would be on the top side of L5.
L5.
You were confused too?
Well,
Sorry, I just had
I think I taught him.
You taught him different?
That's what I was.
Sure. I don't want to confuse you guys because I like our difference in how we treat mice. I don't want that to confuse you guys in practice.
So
So essentially, because she's in this position here, it's because she's in this position here, we're trying to create the rotation to the right. So my top hand is going to be on the top segment. It's going to be on the top part here. The bottom segment is going to be here because when I apply my force through my trunk, I'm pushing her back. So my hand is just an extension of my trunk here. So
So that's okay. So
I'm just gonna you palpate her. We'll just say this is L3, L4. Palpate her until we feel it stop moving. Lock her here. Change your hand. Don't lift your hands up. If you do, then you just better recount to where you are. If you lift your hand, you don't have to restart here. You just go to L4, L5, and then go back up between L3, L4. Next one, you're going to rotate until she stops moving here. And this is what locks the facet joint. The flexion locks the supraspinous and interspinous ligament. Sorry. And then put this on here. So she's locked. She's set. And I'm going to do that. If you get the one where you have to set the level, we're going to do that just to see. And see how she just evens out because she's set properly. So what I'm going to do here is back at the L3 spot, top here, bottom here. And essentially it's like a belly-to-belly suplex for all the guys who used to wrestle. Or watch wrestling.
Watch wrestling.
yeah.
And so you just lock her out. And so here I usually just do it like that. This table is kind of moving a little bit.
It's automatic fail. Just to let you know.
That's the Howard table.
So I take up all the slack. She's locked there. Take a deep breath in. Breathe out. And then just real quick like that. But you're not going to have to adjust or manipulate anyone. I'm just going to make you set the level.
Oh, just set it.
And set. It facilitates the right rotation or left side bend because she's side bend.
And in this position, you'll be treating her facet.
Top side up is the facet.
And then
Bottom down for disc. So if it's a disc issue, you should put the disc issue on the side toward the table. If it's a facet issue, you put it up. If we're trying to open the facet versus close the dips.
So
I said that in lecture, so.
Why would you choose this for a disc opposed to like your PA?
You could do a PA.
Oh.
This is a more aggressive technique, but if you are 100% sure it's disc and you wanted to get treated quick, in class I teach you guys for manual therapy, always do the less aggressive thing that you have to do in order to help someone. But sometimes, like if you're doing stuff and it's getting better, but it kind of regresses, it gets better, it kind of goes back. Like sometimes I'll just get in there and I'll just manipulate someone's neck because I'm getting tired of treating. And if you manipulate it, it'll get rid of it a lot faster than the mobilizations will. So that's it. I'm trying to think if there's anything, and then the PAs. That's all.
Or lateral glides can be adopted?
Because I didn't teach you guys how to do like glides, like lateral glides and stuff like that. So.
I mean, like when you got them.
Just rock it.
For someone like this.
Yeah.
Possibly. They could be on there.
What was that, Gina?
For someone who has a lateral shift. So actually you got a lateral shift. So how would you correct that? Sorry, I need to leave. Get to it, right? How would you correct that? So in order to do your correction, you bring his arm here and then you correct him by pushing him.
Oh, yeah.
It's like tackling him.
At the hip, and you pull here.
It's like a
I'm not gonna
tackle.
stand in the front there because then that's a lawsuit or some kind of crazy just talked about. But so if anyone did that, they would get points taken off.
If anyone sexually harassed my
Sarah.
And bring the hands here, and you grab here and pull here. So I'm using my shoulder to block him, and then pulling him here to keep.
Can you put your hands in the air, like not like around them?
And wave them like you just don't care.
All right. Thank you.
Yeah, I'm just like this. So
tuck your
just
pinky, Anthony.
just like this.
Where do you go there?
So like this, and then correcting like that. And you
So-
could do static, or you could do oscillations if the person couldn't withstand certain forces.
Okay. All right.
All right.